Horizontal wisdom tooth extraction requires precise planning using 3D imaging to protect adjacent teeth and nerves.
Local anesthesia is carefully administered to ensure complete comfort throughout the procedure.
The oral cavity is thoroughly disinfected with an antiseptic rinse to prevent contamination. A surgical incision is made along the gum line to access the underlying bone and hidden tooth. The gum tissue is elevated, exposing the crown of the horizontally impacted molar. Targeted bone removal creates space around the crown, allowing room to maneuver and elevate the tooth. Because horizontal teeth cannot be pulled intact, the tooth must be sectioned into smaller pieces. A surgical drill carefully splits the crown from the root structure. A specialized elevator leverages the gap, separating the crown from the root. The remaining roots are gently mobilized and sectioned further if fused or curved. The roots are carefully lifted out while preserving the integrity of the nerve channel beneath. The empty socket is thoroughly irrigated and inspected to clear away bone fragments. A collagen matrix or PRF plug may be placed to accelerate healing and support the blood clot. Resorbable sutures close the surgical flap securely to protect the healing socket. With proper home care and oral hygiene, complete soft tissue healing occurs within 1 to 2 weeks.